All right, a very good morning to you. How are you doing? I hope that you're well, that you've had an amazing week, right from Monday and of course the weekend, because we weren't here during the weekend with you guys, and of course on Monday and Tuesday. And we're very happy to be here yet another beautiful Wednesday. And of course, unajua ikiwa ni Wednesday, ni siku ya Afya Clinic, where anything ambayo unapitia, if you're sick, if you're not doing well, this is where we get solutions. So karibuni sana. We are going to be having an amazing time. My name is Kahugu na tutakuwa hapa mpaka pale 10 in the AM. Of course, this is MBCI TV ambapo tunabadilisha maisha by the grace of God, and the show on air is the one and only Rao Show, and of course Afya Clinic hapo ndani. All right? And today we're going to be having an amazing outline. Okay, because we are going to be starting with the health updates, where we get to inform you ni nini inaendelea, mambo ya health updates you need to know. And of course, on matters health of late, umekuwa ukisikia mambo ya SHIF, SHA, and probably you'd wonder what exactly is SHA, or rather SHIF, the SHIF, which is changing from NHIF, and what exactly does that mean to you and me? Yeah, so that is what we are going to be getting today ndani ya the health updates. And then of course after that we are going to be having our guests together here with us, and of course leo ikiwa ni siku ya Afya Clinic, tutakuwa tunaangalia masuala ya afya, so don't miss out. It's going to be really amazing. And then of course tutakuwa na in history, where we get to know exactly how tuberculosis started. What do you need to know about tuberculosis? So of course in history imeandaliwa na the one and only High Five, and you're going to be getting more about the tuberculosis in that particular segment, and many more. Of course tutakuwa tukimalizia pale 10 in the AM, na tukimalizia we'll be having an amazing time just to enjoy music. So if you have any song request, this is the time, through our numbers 0721 105 105 23814 on our SMS code, and of course MBCI TV Facebook page on the comment section, and MBCI TV official YouTube page on our YouTube channel. Of course on Facebook on Rachel Kahugu, utapata an amazing poster there. So if you have anything you'd want to tell us, andika tu hapo kwa comment section, and we'll be able to get your feedback. But of course, for every comment today, we'll be using hashtag Afya Clinic, hashtag Kahugu, so don't miss out. It's going to be really amazing. Kwa hivyo karibuni sana. We'll be having an amazing time. Of course, as I've told you, my name is Kahugu. We'll be here up to Masaya 10 in the AM. All right? And now let's get into the health updates. And as I have said before, today in Dania the health updates, we'll be looking at SHA, or rather SHA, depends vile unaita SHA ama SHIF, but ni sisi wote tunajua NHIF. So we are moving from NHIF to SHIF. But now, what does SHIF, what does the shift from NHIF to SHA mean to you and I? So for beginners, SHA is a state agency established to manage the Social Health Insurance Fund, which is the SHIF. And this is one of the three funds, others of which we will not really need to discuss today. And they are the primary healthcare funds and the emergency, chronic and critical illness fund. So these three funds are different, they have different mandates, and their monies have different sources. Yes, so starting July 1st, 2024, access to healthcare started the transition to the new Social Healthcare Authority, that is SHA. But what is the core reason for this transition? Let's hear about it from the one and only President William Ruto. Contribute 2.7% of their income as a deduction, and this is a reduced minimum monthly contribution of 300 shillings, down from the previous 500 shillings required by the National Health Insurance Fund, that is the NHIF. The benefits package in the new SHIF insurance include medical outpatient services, end-of-life services, surgical services, specialized pharmacy benefits, medical inpatient and critical core services, accident and emergency services. We have optical services, we have mental wellness services, we have specialized essential services, we have renal core services, we have overseas treatment, kama unataka kwenda nje for treatment, we have dental healthcare services, of course we have rehabilitative services, we have screening for common diseases, we have assertive devices, we have maternity and child health services, we have oncology services, and we have medical imaging services. Yes, all of that under shift. Now you see why the transition is very important. And the cost of maternity, newborn and child health services at level 2 and level 3 hospitals is 11,200 shillings for normal delivery, and then 32,600 shillings for cesarean section or CS, kama vile wengi wetu tunaijua. So this means that the Linda Mama program, which allowed expectant women free delivery services, has effectively been scrapped off. Yes. Now, the Ministry of Health has issued a guideline to employers on how to migrate their employees from NHIF to SHA, which is the SHA, and this is the body which will manage the Social Health Insurance Fund, which is the SHIF. Okay. Now, in a public notice, the ministry said that NHIF will be transitioned in the Social Health Authority (SHA) effective October 1st, 2024. Na inakaribia sana. And the ministry has been urging the members of the public to register with SHA to facilitate their inclusion to SHIF. It said that the last NHIF admission will be on the 30th of September 2024, while SHA benefits will commence on the 1st of October 2024. Elijah Washira, the CEO of NHIF, said on a statement that payments received on or before October 9th, 2024 will be credited to NHIF, and then payments received from November 9th, 2024 and onwards will be credited to SHA, which is SHA. Yes. So I hope tunaelewa sasa. What is the difference of SHIF, NHIF, and of course SHA? So we've seen it's very important for us to transition. So if you've not done that, please make sure that you go to their website and do what you are supposed to do. So that is what we get today on the health updates. If you have any question about the SHIF, NHIF, and SHA, please feel free to ask. Feel free to comment on our numbers, as I had told you before, 0721105105 on WhatsApp, 23814, our SMS code, which is absolutely free, of course, on my Facebook or any social media page, which is Rachel Kahugu or Kahugu. Ukisearch tu utaipata. But of course, you can also text us on MBCI TV Facebook page and MBCI TV official YouTube page. Just use the hashtag Afya Clinic or hashtag Kahugu, and then we'll be able to get all your comments. Tutakuwa tukijibu maswali yote yenu. And we've told you as well, we'll be having a doctor today, so don't miss out. It's going to be an amazing show. But for now, let's get in history so that we'll get to know more about tuberculosis.
Tuberculosis, caused by the bacterium Mycobacterium tuberculosis, has existed for thousands of years. By the late 19th century, as European colonization expanded in South Africa, the region began to experience its first significant encounters with the disease. The arrival of settlers and the subsequent urbanization laid the groundwork for TB to take hold. The discovery of diamonds in 1867 and gold in the 1880s transformed South Africa's economy and social structure. The expanding mining industry drew thousands of laborers from various regions, creating a demographic shift. This influx led to the overcrowding living conditions in mining towns, where sanitization was poor and healthcare was virtually non-existent. These factors created an ideal environment for the spread of TB. The colonial administration's policies during the 19th and early 20th centuries contributed to health inequalities. Access to healthcare was limited for Black South Africans, while white populations had better medical facilities. This disparity in healthcare access heightened the impact of TB among marginalized communities. With the establishment of apartheid in 1948, systemic inequalities intensified. The apartheid regime enforced segregation, resulting in inadequate living conditions, malnutrition, and limited healthcare access for black populations. TB flourished in these environments, and by the 1980s, it was clear that the disease was a major public health crisis, particularly among those living in impoverished townships. In the late 20th century, the emergence of HIV epidemic compounded the TB crisis. South Africa faced one of the world's highest rates of HIV infections, which significantly increased the risk of developing active TB. The co-infection of TB and HIV created a dual epidemic, straining the already fragile healthcare system. In response to the growing TB burden, the South African government and various organizations began implementing public health strategies in the late 1990s. The introduction of the directly observed treatment aimed to improve TB treatment adherence and outcomes. Additionally, integrated approaches targeting both TB and HIV were developed to address treatment access and community education are paving way for a more comprehensive approach to tackling TB. The history of tuberculosis in South Africa is a complex narrative shaped by migration, socio-economic factors, and systemic inequalities. Understanding this historical context is crucial for addressing the current challenges and improving public health outcomes.
All right, we are back after that very short break, and of course you've seen where tuberculosis ilianza wapi and how the history is like, because most of the people in Ninajua, we really didn't know about tuberculosis, and we have that in history segment because that is what we are talking about today. So today we'll be talking about tuberculosis, yani TB. Watu wengi tunajua kama TB. And today we'll be having a doctor with us, and we will be having Dr. Diana Mutemi. And Dr. Diana is the Tuberculosis and Leprosy Coordinator in Nakuru West Subcounty. Yes. And vile niliona was asking leprosy, really? And I remember tulikuwa tunaulizana with our producer hapa, leprosy, si tunaionanga tu kwa Bible. And that's it. So we'll be knowing more about it today, but stay tuned. Remember, this is Afya Clinic, of course, ndani ya Rausho. So if you have any question, feel free to ask about tuberculosis. Na pia unaweza guzia leprosy kidogo, because we've seen ni kama ziko related. All right? So remember, we are here with Diana Mutemi. She is a doctor, and we'll be talking about TB. Our numbers are very open. Once again, 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free. But of course, we're live on Facebook, on MBCI TV Facebook page. We are live on YouTube, on MBCI TV official YouTube page. On my Facebook account, Rachel Kahugu, you'll find an amazing poster right there as well. Pale kwa comment section, if you ask any question, we'll be able to get back to you. Kumbuka kutumia the hashtag Kahugu, #Afya Clinic. All right? Karibu sana, Doc.
Thank you.
How you doing?
I am well.
How have you been?
I am well.
Amazing.
Yeah,
we're very
you.
happy to have you here today.
Sure.
Yeah, we are very happy to have you today, and I know that you'll be having an amazing conversation.
Sure.
Yes.
Thank you for having me.
Karibu sana.
Asante.
Now, today we are talking about TB, but nimeona kuna story ya leprosy hapo ndani kidogo. Sasa the last time we heard about leprosy ilikuwa kwa Biblia.
Yes.
Tell us a little bit about it.
Leprosy is a disease and widely classified together with tuberculosis. It's because of the causative organism.
Okay.
That which causes TB is the same one which causes leprosy. It's a bacteria called a Mycobacterium. The difference is that it's a different species.
Okay.
For leprosy, it's called a Mycobacterium leprae. And for TB is Mycobacterium tuberculosis.
Okay.
So yes, the family is one.
Ah,
Sure.
Very interesting. Now, we are at the top of the hour. It's 8 in the AM. Now, because of that, we'll be taking a very short break. Now you know what we are doing today and you know our numbers. So we're taking a very short break. As we come back, we'll be coming back to dive into the topic. Kwa hivyo usiende mbali. Make sure you stay tuned, call in other people and share the links for everyone to understand what we are talking about today. So a very short break and then we're coming right back.
MBCI Television, transforming lives.
Angurumapo Simba, mcheza nani? Utaisemaje kwa Kizungu?
It's about to go down.
Si ni muoga. Ni muoga. Mari Simba imeguruma. Unajua hata ikiguruma ukiwa hapa hivi utatoroka.
Nataka unikamilishie methali, asiyejua utu.
Utuzo. Utuzo.
Na the shortest book kwa Biblia ni gani? The shortest, yani wewe kulingana na wewe, the shortest ni gani?
Songs of Solomon.
After Gen Z ni generation gani?
Hiyo ingine inaitwa sijui Flora. Sijui Afro. Kitu kaa hicho.
Ati inaitwa nini?
Flora.
Nao walimshinda kwa damu ya mwana-kondoo na neno la ushuhuda wao. Ni kitabu cha Ufunuo 12 mstari wa 11.
Kwa hapo mtu alizikwa na kanjo.
Unaniona vizuri? Hivi ndio nitakuwa nimebeba jeneza lako and I will be singing luere luere.
Kila siku ya Jumapili kuanzia saa 2:30 za usiku.
Kuanzia leo nataka mambo ngapi? Uniponye ama uniue.
Itakuwa ni kipindi cha uhalisia ambacho kinakuletea shuhuda za watu mbalimbali ambao wamesaidiwa na Mungu. Ukiwa nami Paul Kagi.
MBCI Television, transforming lives.
Perfecto. Now we are back after that very short break. Na sasa ninajua sote tuko ready for this particular discussion. As I had said before, today we are talking about TB, tuberculosis. And we're here with Diana Mutemi, and she is the Tuberculosis and Leprosy Coordinator, Nakuru West Subcounty. Yes, and you had already talked about leprosy, nini, and why exactly TB and leprosy ziko under the same group or the same category. And now we know. Now we're getting into TB. Exactly, what is TB?
TB is a tuberculosis, and it's a chronic airborne bacterial infection, which is transmitted through the air. That's why it's airborne. And it mostly affects the lungs, though it can affect other parts of the body as well. And it's contagious, so it's of a great public health concern. That's why we would want to really create awareness.
Yes. Yeah. Which means ni kama homa, for example. It's transmitted the way, yes, vile homa inakuwa transmitted.
Airborne.
Airborne.
Yes.
Okay. And what is the difference? Kuna different types of TB, ama TB ni TB, because if it's almost the same with common cold, for example. I know people would have throat infection. The other time last week we were talking about throat infection.
Yes.
Wengine watasema wako na cold na mwana kifua. So TB is it just one kind of TB or kuna categories? You'd say that there are different types of TB.
Very good question, because that's what we're supposed to know. TB, we have different types of TB.
Yeah.
Majorly what you said, it affects a lot the pulmonary, which is the lungs, when we say, but it can go to the other parts of the body. So we have what we call pulmonary tuberculosis, and as well we have the other type of TB that we call extrapulmonary TB. So the bigger percentage of people get what we call pulmonary, because as the mode of transmission, When you inhale the bacilli, the bacteria, now it's called a Mycobacterium tuberculosis, you inhale it through the air.
Okay.
When someone who has TB infection, either coughs, either sneezes, and then it's dispersed in the air.
Okay.
So when you're breathing, you'll breathe it in if you're in a close proximity with that person. So when you inhale, it will go straight to your lungs. So the infection starts there, and in an event that it gets into the bloodstream or the lymphatics, it will be able to be disseminated to other parts of the body.
Okay.
So yes, we have different types of TB.
Okay.
Sure.
And how would you know that you have TB? What are some of the very serious symptoms or symptoms zenye utaona na utajua this is specifically TB and nothing else?
Yes. We have some classical signs of TB that we can watch out for. Mostly people present with cough, especially those who have the pulmonary type of TB.
Unajua kuna watu washaanza kuwa scared vile umesema cough.
Yes.
Everyone is like, wait a minute.
Yeah, that's very good.
Yeah.
Because now we want that a high index of suspicion. Because if we ignore, you might be having that cough and then you feel, this is just a mere cough. So it's good to take it as a one of the signs.
Okay.
Actually, we say cough of any duration. Long time ago, people used to think like it has to be this chronic cough.
Yeah.
I cough for like a month or so. But now we tell people to be vigilant, to look into this cough. And then other signs are like unexplained weight loss. You are losing weight, you've not engaged in any activity to make you lose weight, but then your weight is just going.
Okay.
We have other signs like drenching night sweats. In the night.
Maybe before the sweats.
Yes.
Ear weight loss. Does it have to be in a short period of time? Or ukiona una lose weight over probably a month? Would you weigh it with a month ama lazima ikue over a short period of time?
It's gradual. It's gradual. Some of people lose, especially people with big weight, they may lose the weight like suddenly. Though, as we said from the start, TB is a chronic infection. Okay. Chronic meaning that it takes quite some time, a long duration of time.
Okay.
So mostly it's gradual. You're weighing and you feel like, my weight is not right.
Yeah.
For people who don't go to scales most oftenly, you might be, where for men, your belt, you feel, I was using this button, a hole. And then now, for us leading our skirts, we'll tell you be rotating. You just feel the signs of a weight loss, which is not deliberate.
Okay.
Yes. And then now we go together, sweating. Actually, people get drenching night sweats. In the night, you're sweating a lot. And then other signs are like a fever. Fever, you have these fevers on and off. Even some have a persistent fever. But it's good to note that we are not expecting these signs to come, all of them together. Yes, actually you can be having one sign and yet you have TB. So for us to wait for all the signs to come, it might be a little bit late. So it's good to be vigilant. Yes.
So for the sweat, it has to be drenching so that you'd know. If you see you're really, really, really sweating,
yes,
then you have to seek medical attention.
Exactly.
Okay.
Yes.
And what exactly are the causes of TB?
Before we go there, I would want to add other signs, especially for the children. For the children,
different for the adults and the children.
Now, these are the classical signs. These ones will appear in both the children and adults. But for children, it might not be these classical signs. We might have other added signs. Like in children, you see your child is not playful as before. You may see weight gain is poor. If it's for the kids who are still going to the clinic, you know, the card will be showing like the trend is not very right. A kid, milestones might be delayed and a failure to thrive. These are some things which are really, really key to watch in children. And then recurrent chest infections in children. Like your kid has pneumonia today, tomorrow is coughing, you know, taking antibiotics now and then. Those are very key things to watch for children. So for children, we don't wait for it to present classically as in adults. Yes.
So you have to be very keen with kids in terms of weight, how they behave, they're not playing kama kawaida.
Exactly. Yeah, for a mom knows their kid very well, so you'll be able to know when your kid is not all right. Yes.
Okay. So now what are the causes
of TB? Oh, thank you. So the cause of TB, as we said, it is a bacterial infection. And for a bacterial infection to happen, there has to be that microorganism which causes this. And as we said before, is that Mycobacterium tuberculosis, bacilli.
Okay.
So yes, it has to be there. There has to be what we call an index case. An index case is that person who has the infection and is not on treatment. So whenever they cough, whenever they do anything, you know, they are exposing the bacilli into the air. Yes.
So there's nothing, for example, you'd say anything specific, it's only kuna mtu mwenye akona TB, so kimkaribia, or generally it gets transmitted as you've explained.
Thank you.
All
Absolutely.
Right.
There has to be a source of infection.
Okay.
Yes.
So what are you supposed to do, especially now with the cold, so we are having people who have colds.
Yes.
So as an individual, what are you supposed to do to make sure that you are not infected by any chance with TB?
Thank you. That's very important because first of all, it starts with information.
Okay.
Like now what we're doing now, we are sensitizing the community to know what to look out for. And then now when you get this information, now you'll be able to know your body and you know when you're not right.
Okay.
So when you have this cough, it's a cold, yes, we know. We don't go to the hospital at the first instance. But if you feel the cough is persistent, I have taken maybe an antihistamine today and I'm not well. Please, let's go to hospital and get checked. And then it might be coupled by another thing like I don't feel like eating well, you know, I'm not functioning well, your body is just not right.
Okay.
We go to the hospital.
What happens, especially for men? I know this is a case with a lot of men. You're not feeling okay, but you don't feel like going to hospital, and you decide to become your own doctor. So you use over the counter drugs, and then it persists. So nenda hosi when it's already too late. So is there a danger of that?
Very much, very much. As we know, the way we can now, as we said, there has to be transmission in the environment or in the community. And the way to cut this transmission is to ensure that early diagnosis of TB happens. If you have this infection and you have another person has, and we're in the same community, what are we doing to our community? We are making this bus, we are transmitting. What we call community transmission is happening very, very much. So when we develop this culture of health seeking, it will be very good to our community. That's true what you said. We are not victimizing our men. You know, ile kujituma kwa kazi. They work so hard. We appreciate that until they forget themselves. So like you may find, this is just a cough, what we said. The cough persists until it's a little bit late. So, and we say the earlier you diagnose TB, the better. First of all, what we just said, the community transmission is cut, which is very good. Number two, the earlier you treat TB, the better, because the prognosis or the progress is very good. You will not fail to go to work because of TB when it's diagnosed early. So your income will still be stable. You know, your duties will not stop. You'll still be working, right? And then we'll avoid complications. Yes.
So what are these complications?
These complications, when definitely the bacilli, if it's pulmonary TB in the lungs, the bacilli is there and it's multiplying in your lungs. So it will affect the lung tissues, definitely. And you know the lungs are very important. They are the organs of respiratory breathing. So what happens to your lungs? They will get some things that we call, if you're treated late, some things like lung fibrosis, whereby they heal with a lot of scarring. So the ability to expand and contract when you're breathing, it's really
becomes a problem. We
have other many complications. We have issues of I don't know, bronchiectasis, if I may say that. These people, there are some people who are diagnosed with some issues of coughing, producing a lot of sputum, a permanent damage to your airways. It can happen.
So you can't, ukikasana, you won't heal?
You will heal. The TB will be cured, right? but then there are permanent damage to your lungs that can happen.
Yeah. Okay.
Yes.
Okay.
A lot, many of them, if we can mention, but I don't want us to go there a lot, but the most common, lung fibrosis, that bronchiectasis, as we said, the permanent dilatation of your airways.
Okay.
So it has a lot of impact because you'll be getting a lot of sputums in your airways, and then you'll be getting these recurrent infections, a lot of pneumonias, and you are capable of getting another bout of TB again. Many others, and if it's another part of the body which is affected, like we've heard of TB spine, right? TB of the bones. So, yes. Actually, we didn't mention this. What we call extrapulmonary TB. TB can affect all parts of the body. All parts of the body, apart from the nails, the hair, and the teeth.
Okay.
But all the other parts of the body, the organs, the tissues of the body can be affected by TB.
Even the bones?
Yes, even the bones.
Okay.
Actually, it's common for the bones.
Okay.
Yes.
Oh, okay.
Yeah, so what we're saying about the complications, like you may get someone with a collapse of the spine simply because of a TB, which if diagnosed early, it can be cured and prevent such disabilities.
Okay.
Yes.
Okay, so it's very important for you to go to hospital on time. Go early. Okay, notice tu ni kama there's a problem somewhere. Make sure you go get checked.
Yes.
It's very, very, very important.
Very important.
Now, the people who say walipata TB and then later, unfortunately, probably they pass on to glory.
Yes.
And then utasikia watu wakisema hapana, hata iko kwa TB ilikuwa complications ya vitu zingine. Right? Probably they had another complication or walikuwa na ugonjwa ingine. So if for example, someone has any other disease or any other complication in their body, would it affect, if they get TB, itafanya ikuwe worse? Or it's not connected in any way with any other disease?
It is connected, I would say, because we know immunity of the body plays a very crucial role in the TB control. Like if you have a very competent immunity and we are in a community like where there is a lot of transmission happening, and we can inhale the same amount of bacilli, and I'll develop the disease, and you might not develop the disease. So what we call, let me say there are two types: latent TB infection and an active TB disease. So for the latent TB infection, it's good to know when you're exposed to this bacilli, your immunity can contain the bacilli, and then it's contained at the point of entry, at the lungs. It will enter, and then in the lungs, the immune response and everything, they'll be able to contain the bacilli, and it stays there, awaiting for an opportunity for your immunity to go down, and then
it manifests.
Yes, it manifests.
Okay.
Then a person with an immunity which is not very competent, they will be able to inhale that bacilli, and when it gets into the lungs, the immune response will be not as strong to contain this bacteria. So definitely it will grow, multiply, and then we'll see the signs and symptoms. So the severity will depend on many things. First of all, the immunity. Second, the time that you went to hospital. So if you are a person who had another disease that already compromised your lungs, you can imagine it may be this severe form of TB. And then the complications might be directly related to TB, or maybe not directly. It may be directly related to the other co-infection that you have. So it's good to note that. Yes, but it becomes more severe when you have those other infections which are not controlled. But if the other infections are well controlled, like we say, people living with HIV, right? And they are on their drugs medication well, that's a person who lives a very normal life, right?
Right.
So the chances of getting TB, just like another person, right? And then the body immune is good because the viral load is suppressed. Someone with diabetes and they're taking the medication well, the immunity is good as well. Yes.
Okay.
Yes.
Wow, perfecto. Now, we'll be talking also about multi-resistant TB.
Yes.
We've heard about that term, sana, and you want to know about what exactly is the multi-resistant TB.
Sure.
Okay? But before we do that, we'll be getting the myth buster so that you will get to know and see some myths about what you guys think about TB, and it's actually not true. And then Doc atakuwa anatuambia, is it true it's a myth? Ama iko tu sawa. Yeah? So it's very important for us to know what exactly is true about TB and what is a myth, because I've realized siku hizi tunakuanga tu tunasema TB, you know, TB can kill, but really, as you've heard Doc said, ukienda mapema, then it means utakuwa tu sawa. Okay? So the only problem would be if utachelewa kwenda, and then you'll develop other complications, right?
Yes.
You develop other complications, alafu kienda, it becomes, una realize it's already too late. So, if you realize you're not okay, make sure that you go to hospital early enough. But also, after we've gotten the Mythbusters, we'll be getting some vox pops. Yes, so that we'll get to hear from other people outside what have they experienced on matters TB. Kama mtu ashagonjeka TB, how was the treatment like? Was it easy for them to get treatment? And how long did it take for them to actually get well? Ndio mjue that you can actually get well. So sijui mwelekezi, do we have the Mythbuster? Okay. Yes. So that is it, as you can see on your screens. Yes, that only people with weak immune systems can get TB. Is it true that only people with weak immune systems can get TB?
Weak immune system is a risk factor.
Okay.
Is a risk factor. But I don't want us to say it's only people with a weak immune system, because even with this good immunity, you will get TB, but it will be latent in your body. So the infection will happen, but it will be latent in your body. But the weaker the immunity, the easier progression to a disease, the TB disease now, and you know, the more intense it will get. Yes.
So how can one improve or build up on their immunity?
On the immunity, right? First of all, is to know what is causing this depression of your immune system, because we know even issues of malnutrition is a factor, it is a issue that causes immune suppression, right? So it's good to check on your diet, of course, that's one of them, and then to be checked in the hospital. Medical checkup is very important, because we know you'll be diagnosed with other diseases that you didn't know. We have silent issues. Diabetes is quite silent, and we know it's one of those things which causes immune suppression when it is not controlled. So it's good to know not only TB that is supposed to be diagnosed early, all diseases and conditions, they're supposed to be screened early. That's why now we are really, really vigilant and very much engaged in screening of non-communicable diseases, which involves like hypertension, diabetes, cancers, kidney failures. Those are all diseases which cause immune suppression. You know, when people hear about immune suppression, their mind straight goes to HIV only. So HIV is not only the condition or disease that causes immune suppression. So it's good to be keen on even other diseases and conditions which can cause the same.
Okay.
Yes.
Now, the other Mythbuster is that you can catch TB from touching someone.
From touching someone? So I'd say no.
Okay.
That is a myth. Yes. So you cannot catch TB by touching someone. Those are some of the things which cause a lot of stigma in the community. So that is not true.
As we come back, we'll be talking about stigma as well.
Yes.
Because it's something very common in terms of TB. The other Mythbuster is that TB only affects the lungs. I know you've talked about it.
Yes. So no, it doesn't affect only the lungs. We have that challenge when people are not have the right information. Because when you tell someone this swelling here it's caused by TB. They say that I've never heard that.
Yep.
I know only TB affects the lungs.
Yeah.
So it's good to know that, as you've said, it can affect all parts of the body apart from the hair, the nails, and the teeth. So yes, you can be diagnosed with TB of kidneys, you know, TB of ovaries, TB of the tummy, like abdominal TB.
Okay.
So even TB of the skin. So yes.
Okay. Now we'll be looking as well at how to make sure that you do not get this TB. But for now, let's get to see what people think about TB. And do we have people ambao wamekuwa diagnosed na TB and they've been able to go through treatment and come out stronger? Yeah? So let's get into the Vox Pops.
Unajua kuhusu TB?
Ni ugonjwa kama ile ingine, lakini mtu anaponaga. Ukifuatilia daktari vile atakwambia mashauri ya daktari, utatibiwa na utapona. Ilikuwa mimi nilianzia kama homa zile zingine, kukohoa, kusiniz. Nikakaa, unajua kaida wanaume hawaendagi hospitali. Wanaume hawaendagi hospitali. Sasa nikakaa bila kunywa dawa, nikakaa 1 week, nikaona hapana, haishi, nikakunywa madawa ya chemist, nikaona si badiliki. Ikabidi niende hospitali. Nikaenda private, ile haraka mtu anaenda kazi nyingine. Nikaenda private, nikatibiwa homa, alinitibu homa, hakunitibu TB. Ile dawa alinipea, nikaendelea kunywa, nikaona sibadiliki, naendelea kuvinyirika. Nikatoka hapo, nikaenda General Hospital, Karatina. Sasa kwenda Karatina nilikuta bado huko naye ni student wako. Hakunitibu, walinipea dawa, but haikunisaidia. Kutoka hapo nikasema siendi hospitali nyingine. Kama nimeenda private sijapona. Nikaenda ya serikali sibadiliki. Sasa nikaamua sasa hakuna hospitali nitaenda. Nikakaa, kuna mahali nilikuwa nanunua mkate kila jioni. Huyo mama alikuwa ananiuzia mkate, bwanake alikuwa daktari. Huyo ndiye alinisaidia. Kukaa almost 1 month. Juzi ilikuwa 1 month and 10 days. Nilienda 40 days. Hapo ndio nilienda. Akauliza bibi yangu, bona siku hizi unakujia mkate na kitambo ni mzee anakujaga? Akamwambia ni mgonjwa. Huyo akaamua kukuja kwangu kuniona vile niko. Kuniona akaniambia niende hospitali fulani na huyo atanisaidia. Kuta huyo akaniambia kwanza vile niko, hata hakuniambia ugonjwa ile niko nayo. Kaniambia niende picha, niende nipigwe picha, alafu nikuje. Kuja ndio alinionyesha ugonjwa wangu mahali iko, na nikaanza dawa hapo. Sikuwa nakula kitu. Anything sikuwa nakula. Nikaanza dawa, nikaanza sasa kusikia niko na appetite ya kukula. Na nikakula, nikimezaga madawa, na nilienda 6 months. Na hiyo ugonjwa sina sahi, na nikapona.
Kuhusu TB, mimi Kenya naweza sema kuhusu TB inakuja kitu ya kwanza, baridi. Unaweza fanya kazi ngumu, ushindwe kukula. Unaweza kuwa mchukua chakula ukuli kitu kama greens, nini kula ma greens kitu kama hiyo, ushindwe kukula na hizo. So TB mostly sana huletwa na baridi. Secondly, unywe maji baridi, vitu kama baridi, hizo maji baridi. Then usifanye kazi ile ngumu, ukisikia kama mwili yako inaregea kuwa kama TB inavutika ndani, unaona? So mimi Kenya ningesema kama uko na ugonjwa ya TB, tablets zenye umepewa wewe maliza kunywa, usikatie katikati. So mimi nilikuwa na recently nimepata rafiki yangu alikufa juu ya TB. Yeye alikuwa anafanya kazi soko, akapewa hizo dawa, alikuwa ameambiwa kule greens, kule matunda, akakataa, akumaliza tablet. So venye akumaliza tablet alirudi kazi, hiyo tu recently tu. So venye akumaliza tablet akarudia kazi. Sasa TB venye ilitoka kufula miguu chini. Kafula miguu chini, akakuwa wiki mwili na nguvu, yeye anasikia baridi. Sasa kila saa ni kujifunika na jampa. Na unafanya unajua TB inamkula.
Najua kuhusu mambo ya TB kwa sababu kuna rafiki yangu aligonjeka TB na kuwa imemfinyilia sana na amekonda sana, lakini wakati alianza kukohoa tukaenda medical, akaweza kupimiwa kohozi na ikawa ako na ugonjwa ya TB. Kulingana na vile najua TB sana sana ni ugonjwa ni communicable diseases. Inaweza ambukizwa na mtu kama mmekaa pamoja na yeye ama mnashare kitu kama wale watu wanashare vitu kama sigara hivyo.
TB ni ugonjwa ambaye inaambukizana na maneno ya kunywa kikombe moja na mtu ambaye amekuwa nayo, na liable disease azinu, na unaweza kuipata hata kwa mtu kukohoa akikuangalia akiwa karibu na yeye. Ilikuwa ngumu sana kumeza dawa miezi 6, ilikuwa ngumu. Huwezi kuambukizana kwa njia nyingine isipokuwa kutumia kikombe ambaye mtu mwingine ametumia. Na nikwambie ilikuwa ngumu. Juu kama mimi ni mzee, niko na watoto. Na wakati ule, it is about 15 years ago. Ati sahani yangu ilikuwa ni kando, kijiko kando, kikombe kando, kwa nyumba na niko na watoto. Na by then, nilikuwa mpaka na watoto wandogo, ambaye saa zingine atakuja kuja kikombe yenye nimekunywia. Ilikuwa kazi ngumu.
Sijui sana kuhusu TB, but nishaiona mtu ameambukia alikuwa na TB, alikuwa mzee. Sasa huyo mzee alikaa na TB sana muda mrefu na sikuona kari pona. Alikunywa madawa muda mrefu na sikuona kari pona. Alafu mwishowe mzee alikunywa madawa, alipomaliza kunywa zile madawa alikufa.
Ni nini unasikianga watu wakisema huku nje kuhusu TB na unaona ni kama si ukweli?
Watu wanasemaga ni kukohoa peke yake. Kukohoa peke yake sio ugonjwa wa TB. Sio ati juu unakohoa ati juu uko na TB. Ama uko na homa uko na TB. Unafaa uende hospitali uangaliwe. Ukiangaliwa utaambiwa ile ugonjwa uko nayo. Ningeshauri watu wengi, ukisikia ile ugonjwa yote uko nao, uache kukimbilia chemist. Juu mtu wa chemist ni biashara ako nayo. Huyo atakuuzia dawa na sio daktari. But ukienda hospitali uende uambie daktari vile. Sasa mimi nilikuwa nasikia joto kwa miguu, nasikia joto. Ndio alianza kunifuatilia na nikapatikana ile ugonjwa niko nayo.
Asante sana.
Kulingana na vile watu walikuwa wanafikiriaga, watu wengi wakiona mtu amegonjeka TB wanasemaga ako na ukimwi, lakini hilo jambo sio ukweli. Kwa sababu wakati rafiki yangu aligonjeka, afya yake ilikuwa imedhoofika sana, na wakati alianza kupewa matibabu huko medical, aliweza kutibiwa na akaweza kupona na akakuwa akarudi hali yake ya kawaida.
That you can get it from being in an environment where it's cold, and also that there are certain drugs you need to take so that you can get rid of it.
Yeah, najua watu wanafikiria wanasema mtu anaweza pona TB, but mimi kulingana na venye niliona huyo mzee, I think sikuamini mtu anaweza pona hiyo TB. Yeah.
So mimi ningependa kwa mtu mwenye ako na TB, ukitibiwa maliza tablet, kula magreens, kula hiyo matunda unaambiwa, sina lingine.
Asanti.
Karibu.
Yeah, so as you've heard, we have so many misconceptions about TB. Na najua Doc atakuwa akiziangalia vizuri. And just to demystify, ni gani ndio ni misconception, which is true, and among hizo zenye ni ukweli, is it really true ama it's true but pia iko na kauongo kidogo mahali? Yeah, let's just start with mwenye amesema ukiwa mahali kuna baridi utapata TB. How true is that?
Mostly it's related to that, because that's not true. Because the transmission happens everywhere, but why people relate it to baridi, it's because most of these people, their lungs are not functioning well. So the moment they're exposed to this cold, they will be coughing.
Yeah.
You know, they'll be feeling unwell a lot, because already the immunity is down, because the bacteria is eating them up.
Yeah.
The lungs are not as competent, so they will complain about this cold more. It will have more impact on them, and then they'll directly associate it to the cold. So yes, it's not the cold which is causing the TB. Yes.
Okay. And we've had mwenye amesema anakula greens, akikuwa na TB anakula greens, and then atakuwa sawa.
Yes, that is the nutritional aspect, which is of course, he was not able to explain it very well, but it's very crucial. We know that greens are full of, nutritional value, the vitamins and, everything, it's there. So if you eat the balanced diet, of course, nimesikia mwingine amesema matunda, your greens, your protein, it's very good.
Okay.
Nutritional aspect on TB, and when you're on care, it's very good. When you don't have TB, it will contribute to your immunity.
Okay.
So nutrition, yes, it's good.
Okay.
Yes.
And now for the people who have TB, what's the infection prevention and then control?
Infection prevention control.
Yeah.
Very important. Very, very important because if our environment is safe, we'll be able to cut this chain of transmissions. It starts with the issues of personal, etiquette, like when you are coughing, you use the right etiquette for coughing, right? So that is very important. We have people who cough just anyhow. Anyhow. So we have to use the right one. The people who cough on their palms, which is not very well, because you'll cough on the palm and then we'll meet and then I'll greet you. We have the right one, I would say. We encourage using the inner part of your elbow, like this. Or if you have a handkerchief with you, it's really good. Open it up, a cough, and then you keep it safely. If you have maybe a serviette or a tissue, you can cough on it and then you dispose it safely. Issues of ventilation. As we know, it's airborne. So this air circulation is very important. So whenever we know we walk a lot, we travel a lot in public means. When we are in those public means, let's make it a habit of opening the windows so that you may ensure the air circulation is good. Lighting is very good.
Lighting?
Yes, lighting.
Why lighting?
Because the dark areas, the dark corners, that's where the bacilli is like hiding. Yes. So it's good to light up. Generally, hygiene. Hygiene is very good. Let's keep our homes clean, especially when you have someone who has TB in the home. It's good to make sure that their bedding, their clothes are kept clean. I've had someone talking about sharing utensils or something. It's all about the infection prevention. You will not come and find me using this cup and immediately you just take it and you use it. That's not only for TB, it's generally about hygiene. So it's not good like a stigma, ati ninamwekea vyombo zake kando kwa sababu ako na TB. No, that is not right.
So just clean them very well.
Let's clean them using soap and water thoroughly. And then it's a bacteria, so it will be able to be killed by our soap and then we rinse with water thoroughly and we're good.
So ukiosha tu uko sawa.
Ukiosha uko sawa kabisa. Tusitenge vyombo. It creates a lot of stigma. So I think generally in the community, and then we cannot talk about IPC without talking about the getting checked, of course, early, diagnosing early, and treating early. Yes.
Now let's talk about the stigma that you've just mentioned. Kuna mtu mwenye mentioned that is it a friend of his amekuwa diagnosed na TB and then people thought that he actually has HIV.
Yes. I don't know whether you'll allow me to talk about in the IPC something very important. When you are a close contact of someone who has TB, definitely you stand a higher risk of contracting the disease. Let's say it's a family household member who has TB. You have a spouse, of course you're so close. You have kids and you have the other household members. You have workmates who are very close to you or friends. So we usually, as part of IPC, someone has been diagnosed with a bacteriologically confirmed TB in the parts of TB, the one which has been seen in the laboratory test that you have the bacilli in you confirmed. We encourage the close members of your family and the close friends to be checked for TB because it's communicable. I heard someone talk about it being
Yeah.
infectious and communicable. So you could be having been infected.
Yeah.
You could be having either a latent disease. Actually, you have either a latent disease or the active disease.
Yeah.
So you'll be go to hospital. You'll be called, invited to the hospital to come and be checked.
Okay.
And if we confirm that you don't have an active disease, you will be given some medication for preventing. We call them TB preventive therapy.
Okay.
So that is very important. That is very key. If you find out that you have active disease, now you'll be diagnosed early and treated early. So to the community, whenever you come to hospital and we call your family members, kindly, let's not have stigma.
Yeah.
Please, Afya, come. It's very important. This TB will be able to be prevented and treated at its latent state.
Yeah.
So that's very crucial to our community. Please, let's do that.
Also love that you said that the minute it's detected early,
Yes.
then it means it's very easy for you to get caged early.
Absolutely.
Na atapona mapema tu,
Absolutely.
atapona vizuri without any
Vizuri
complications.
kabisa, vizuri.
Okay,
Yes.
so if you're there and you feel like you have any complications, just go get checked. It's very important, not quite important. It's very important for you to get checked early. Now, we're talking about the multi-drug resistant TB. Yes. So what is that and how does it differ from the normal TB?
Okay. I want to start at the bigger classification, which is drug-resistant TB. That is what it is because we have drug-sensitive TB, which is the normal TB now. The one, it's sensitive to our first-line treatment.
Okay. So the first dosage.
The first line, yes, the first line, which is we call it the first line and then the second line.
Okay.
So the most common type of TB that we get is the drug-sensitive TB.
Okay.
And that one is treated for 6 months. Yes, and you
Okay.
get cured at some phases with very close monitoring by the healthcare worker. We work with you, we support you until we achieve an outcome.
Okay.
Then when you talk about drug-resistant TB, this is when we find that the kind of an organism that you have is resistant to our first-line drugs. So we
So
say
what happens?
you have drug-resistant TB. What happens? As we said, it's diagnosed in the laboratory through the test that we do. One of them is gene expert to be able to tell us whether it's resistant, or the culture, it will be able to tell us whether it's sensitive to the normal, the first line drugs. So we have drugs for that.
Okay.
You'll be able to come to the hospital, we investigate you more, and then you'll be treated.
Okay.
It's treatable as well. So what we recommend and urge the public is that adherence. Drug adherence is very, very important in the treatment of TB.
Okay.
Yes.
So lazima wamalize dosage.
Hiyo ni
Hakuna
lazima.
kuskip.
Tafadhali.
Yes, because
For us,
some people wakifika mahali and then they feel like they're okay, they're like, why do I need the rest of the dosage yet I'm already fine?
Yes.
Yeah.
Actually, TB is one of the diseases that is, if done well, if the patient is cooperative, it's one of the easy diseases to treat. Actually, it responds so well to treatment. In 2 weeks, for a person who was not able to wake up, they'll be up and
they'll be good.
They'll be good. So
Okay.
by the time we finish the first phase of 2 months, that person has added weight. That person is able to do their daily chores. And now that's where we get the challenge for people who are not well adherent. They'll be able to, some of them just assume, I am well.
Yeah.
But it's good to put it clear that you are not well. The bacilli has just been contained kidogo, but it's still there. It's still able to grow and multiply, and then cause a more severe disease with more complications.
Okay. So that is the drug resistant.
Not necessarily. I would say that is one of the factors. That is one of the factors that can lead to drug resistance. Yes, the non-adherence to treatment. There are those people who are yes, they're taking the medication, but they're not taking it the right way. Leo umesahau, leo nimekunywa asubuhi, kesho nimekunywa jioni, like that, And there are those who completely abandon the treatment.
Okay.
Yeah.
So it has to be consistent.
It has to be consistent.
Okay.
Yeah, that's why we work with you. Actually, at first, we work with you weekly to make sure that you understand. Before we start the treatment, we do what we call drug adherence counseling to make sure that you understand about the treatment and that what you have is something that is curable.
Okay.
Yes.
And you've said for the first line, you see?
The first line treatment.
First line treatment.
Yes.
It takes 6 months?
Yes.
Okay.
Yes.
And are there other options for other alternatives for treatment? Ama lazima when your dosage just 6 months and you'll be good?
Oh, no. We have no any other option for the drug-sensitive TB. We do it in phases. The first phase 2 months.
Yeah.
Then we check whether you're okay. And then the other phase of 4 months.
Okay.
Yes. Close monitoring is very key.
All
we
right.
work with you. We keep on, counseling you. We listen to you. And we move together until the end.
Okay. Why is counseling very important during this session?
It is very important. The support is very key. Right from home to the facility and to the entire community. It is not an easy journey. Definitely. There is that stigma, what you said. The moment you are told that you have TB,
everyone is shocked.
You need to be supported a lot to be made understand that this is TB, it's curable, and it did not happen to you because it's you. It can happen to anyone. Yes, that's very important to understand. Then, of course, the pill burden, the pills, it's treated with, the good thing is that we have what we call fixed dose. One tablet has 4 components in it. So according to your weight, there are those who take like 2 tablets, and we have other people who take up to 5 tablets.
Per day?
Yes, per day.
Okay.
Yes, 5 tablets per day. Plus actually even another one, you make it 6. So that needs a lot of support. A lot of support, a lot of counseling that what you're doing is worth doing it. And then not forgetting the duration of time. 6 months
is
not easy.
Yes, half
so
an year.
We understand that, and we know we are doing this so that we may achieve the ultimate cure of the disease.
Okay. And what are some of the side effects that are related with TB treatment? If there are any? Yes.
Like another drug, these are chemicals, the drugs, of course. So the side effects can range to very mild ones, just the normal ones of some people take paracetamol and they're nauseated, right?
True.
So it's true. They can be those mild, like the nausea, vomiting.
Loss of appetite?
Yes, loss of appetite. Yes, it's there.
Okay.
It's there. Hata kuna watu wengine wakiona tu dawa wanaanza kutapika bure, right?
Why is it that before hata ukunywe dawa unaiona tu and you're already feeling nauseated?
Yes.
Or it's the mindset?
It's the mindset.
Okay.
It's a mindset. Then we have other issues, very, very mild ones, which are short-lived. Like when you start taking it, if those who have taken, they know there might be this a little bit of a urine color change to some maybe reddish, brownish. So that's why we do counseling to let people know that this is normal and it's expected.
You shouldn't panic.
So you shouldn't panic. In 2-3 days, that will be cleared, and then you move. Some people come with some rashes, just a small reaction of rashes. They may be mild or severe. So we urge people to come to the hospital, and then we review you, and we see what we can do to it. Some people get yellowness of eyes. You will come, we check the intensity of the illness, and then we run some tests to see whether your liver is okay. So they range from a mild. Very common one is a tingling sensations on your feet or your hands. So these are some of that we have, but we usually couple our drugs with something, a B6 complex vitamin, to make sure that some of those effects are minimized. So we have other intense ones, like effect to our liver and our kidneys. So that's why we ensure that we move with you.
Yeah.
We review you either weekly or 2 weeks, but at the later stage of treatment now, when we're sure that you're stable, we start seeing you monthly.
Yes. Okay, so it has to be something that you're following up. Daily.
Definitely.
All
yes,
right.
very closely.
Wow.
Yeah.
Now, you've said in terms of in a community, when you realize that there's someone mwenye anakani kama they're having a cough or any of that, it's very important for me to advise them to go get checked, right?
Very, very important.
Yes.
Yes.
But now, normally, apart from what you've said, to make sure that you clean, usiguze uso yako sana, you cough very well. Especially nowadays in this, kila mtu coughing tu hivi. Yeah, so you make sure that you're coughing well and all that. Is there anything in terms of the vaccines, in terms of vaccines or things like that, that would help one make sure that you won't get the TB? Yes.
The vaccine for TB that we have is what we call BCG. BCG vaccine. Yes, ile ya utotoni ukiwa mdogo.
Yes.
So that is the first line of prevention of TB.
Okay.
So it's very good for us to know that that vaccine is very important, which is given at birth or at the first contact with this kid.
Yeah.
So yes, which protects and adds immunity to the body, you know, against TB.
Yeah.
And even if you get a TB, it will be of a less intensity because of that.
Okay, you already have the immunity.
You already have the immunity against this one.
Okay.
So as grown-up people, no, we don't have vaccine for that.
Okay.
So we have to take the measures.
Oh, wow.
Yes.
All right. Now, hajasema nito nani, but anasema hi Afya Clinic, hello. Anasema can TB cause leg paralysis and mental problems?
Can TB cause leg paralysis?
And mental problems.
And mental problems.
Yeah.
Let me address the leg paralysis. What I have seen a lot is what we call the extrapulmonary TB, the TB of the spine.
Okay.
Yes. When it's late, when there is late diagnosis, it can eat up the spine until we get the spine collapsing.
Okay.
And of course, this can have impact to the nerves, so which can cause paralysis also.
Okay.
Yes. About the mental health, what you said about stigma, definitely it needs a lot of support. For someone who doesn't have that adequate support and counseling, they might even sink into depression. So
it can be that serious?
Yes, it can be that serious.
Okay.
You know, people react to things differently.
Yeah.
So if you don't get the right support, the right help, it might affect your psychology.
Okay.
Definitely, anyone diagnosed with TB, they'll feel unwell. They'll feel uncomfortable, right?
Yes.
So that discomfort is definitely a mental issue.
Okay.
So it needs to be addressed, of course.
Okay.
Yes.
Anasema Haika Hugo, hello. Anasema, is it true that one can be infected with TB in a family by using the same utensils like cups? Okay. Yes, like cups and all that. Naitwa Ben kutoka Rongai. I think you had answered that.
Right, yes.
Yes.
Let's just observe the hygiene as we're using the cups. It's good to share, but let's share them clean.
Yeah.
Yes.
So you said it's very important to stigmatize. You decide hizi ndo cups zako because you have TB, hizi ni plates zako. So when you tapon after 6 months, we can continue sharing.
We don't have to do that because we are washing them with soap and water, so they are safe to use.
Okay.
Yes.
Anasema, what are the main misconceptions or stigma that surround TB, and how can we combat them? We had talked about the misconceptions, but what do you, in your opinion, what would you say is the main misconception around TB?
The one that we get a lot is that people who get TB are those who are HIV infected. That is not true.
Yeah.
Actually, even the data that we have is that more of people are infected with TB are the ones who are HIV negative.
Yeah.
Yes, so that is a misconception because as we said earlier, HIV is a virus, right?
Yeah.
So if well suppressed, we live a normal life.
Yeah.
So that one should not even appear anywhere.
Okay.
The other thing is that there are people who think TB is witchcraft, of course, so it's not.
Yeah, for sure.
Yes, it's not.
Uh-huh.
There are people who think TB affects only the poor people. That is not true.
Yeah.
That is not true. It's only that mostly those who are less privileged in society live in overcrowded areas.
Okay.
And that's a risk factor, the overcrowding. They're not very good environments. So TB can affect anyone.
Yeah.
So that poor person we think about, it's all about the environment they're living in.
Okay.
Yes.
So it's not about their status.
It's not about the status. It
Okay.
can affect anyone
Yeah.
of any social status in the community and society. Yes.
Alright. Anasema habari ya asubuhi, mzuri sana. Anasema nimemeza dawa kwa miezi mitatu na bado uchungu uko. Je, hiyo ni kawaida?
Uchungu iko. That is the reason to why we do the follow-ups that we do to ensure that you are doing well. So I would advise that person kindly come to the hospital.
Yeah.
We check what could be the problem, and definitely we will know how you're doing, and we know why the pain is still there.
Okay.
Because we expect if it's TB and TB alone, the prognosis will be very good. So it's good to check whether we have any complications or another thing. Yes.
Okay. And what can be used to confirm that this is actually TB? Because you've had people saying that walikuwa misdiagnosed. Yeah, you go, it's just cough. Alafu naambiwa hapana uko na TB. Ama you actually have TB, alafu unapewa tu dawa za common cold. Naambiwa kana kahoma tu, you will be okay. So what test exactly confirms that it's actually TB? Yeah.
Actually, that came out very clearly from I would call champion, the person who said recovered from TB, because he said at first he thought it's just cough. He was just sneezing, and it took a lot of time, a lot of journeys to the chemist, to the private facilities, to everywhere. It's true. Actually, we are missing a lot of TB cases. We have a lot of TB which is not diagnosed because of such issues. So going to the hospital, even if it's that cough, we are sensitizing about this high index of suspicion in our public hospitals and even in the private facilities. So what happens when you go with that cough? Actually, right now, everybody who is coming to our facilities is being screened for TB.
Okay.
So it's coming with the healthcare provider. Even if you came to the hospital with a fracture, I will want to know whether you could be having any sign of TB.
Oh, really?
Yes, because we're doing it aggressively, what we call active case finding, because we've known that being a chronic infection, people are taking a long time before they come to hospital. So whatever brings you to hospital, I want to take that opportunity and screen you for TB.
Okay.
Actually, we've incidentally diagnosed TB for people who came to hospital with other issues. The other day, there was a person who came to hospital because of falling from a motorbike and thought that they'd been hurt to the chest. And upon taking a chest x-ray, it's not the fracture that we found, it's that TB infection.
Oh, really?
Just like that. So that is why we are doing this. Whoever comes to the health facility, please, community, let's respond to those questions that are applied to us truthfully, because it can be an opportunity for you to be diagnosed early. So we have that criteria of selecting people who we feel that they are presumptive. They are presumptive. We are presuming them to be having TB, and then they'll be sent to the laboratory. A sputum test is taken to the laboratory to check whether you have TB. Even though this depends on the part of the body that is affected. It's not only the lungs, that happens for the lungs, right? So if it's a swelling that you have, like a lymph node or something, we'll get some aspirate from there, and then we'll send it to the laboratory. If it's other parts now, like the abdomen or the bones, we have imaging diagnostic modalities. You'll take this chest x-ray or the CT scan or even the MRI, and you'll be able to get this problem early. But we have this case where people really feel they've been told that they have TB and yet they don't have TB, right?
It's just cough.
Because your sputum has been taken to the laboratory and you are told it's negative. We don't stop there. History of the healthcare worker is very important because that is the starting point. I will know, how are you feeling? You tell me that I have this cough, I have this and that, or I have this pain here. And then I expound on that. When did it start? So how does it affect you? The thorough history.
So you have to take history.
That is where we begin, even before we go to the other things. So I will not just look at you and I tell you, Rachel, you have TB. No, that doesn't happen. That comes from you. It's you will be telling us your story. This is what I feel. So we will ask if it's a kid, we'll be interested to know. Was there a person who had TB or a chronic cough in your family?
So it's generally the history to know if the person would have gotten TB from someone else.
Exactly. Have you traveled to a country which has high TB prevalence? So such issues, and then we investigate. Yes.
Okay. Now we'll be taking a very short break and then we'll be coming right back. Tukirudi, we'll be also looking at some of the questions ambazo mmetuma. So if you have any other question, continue sending them. After this very short break, we'll be coming back to wind up. Usiende mbali.
MBCI Television, transforming lives.
Welcome to Goshen Medical and Technical College Thika, where dreams become reality and futures are empowered. At Goshen, we offer a wide range of courses in both the medical and technical fields designed to meet your aspirations. Medical courses such as Kenya Registered Community Nurse, Theatre Technology, Health Records, Orthopedic and Trauma Medicine, Nurse Assistant, Medical Engineering, Laboratory Science Technology. Technical courses like Catering and Hotel Management, Fashion Design, Hairdressing and Beauty Therapy, ICT and Computer Packages, catering to your creative and technological ambitions. Our students receive hands-on experience through industrial attachment, which we organize for them, ensuring that they gain the valuable practical skills. Conveniently located in Thika Makongeni, right off Garissa Highway, behind Leather Industries. Goshen Medical and Technical Training College is easily accessible. With affordable fees, you can pursue your dreams and achieve your goals with Goshen. So what are you waiting for? Call us today at 0750-264-044. Goshen Medical and Training College Thika.
Empowering future professionals.
Here with the SNS show. We need the whole family at SNS, and we'll be here to have a good time, could dance, could enjoy, could learn, and also if you need to learn anything, Sensei wako na kila kitu. So come to Jibambe, we dance and also have insightful information. We'll be having people talk to us, so do not miss out.
Where we shall MBCI Television, transforming lives.
Hello everyone and welcome to Healthy Living. Today we are going to discuss how to prevent yourself from getting tuberculosis, popularly known as TB. Number 1, the BCG vaccine. In countries with high TB prevalence, the Bacillus calmette-guerin, the BCG vaccine, is given to infants to provide protection, especially against severe forms of TB meningitis. Number 2, avoid close contact. TB spreads through the air when an infected person coughs or sneezes. Limiting close contact with individuals known to have active TB helps reduce exposure. Number 3, good ventilation. TB bacteria spreads more easily in enclosed, poorly ventilated spaces. Ensuring good airflow in homes, workplaces, and public spaces can reduce the risk. Number 4, use protective masks. Healthcare workers and people who interact with TB patients should use N95 respirators to prevent inhaling the bacteria. Number 5, early detection and treatment. People with latent TB infection, that is, those who carry the bacteria but are not sick, can take preventive antibiotics to stop it from becoming active. Active TB patients should follow the full course of treatment to prevent a transmission.
All right, we are back after that very short break, and of course you've seen what you're supposed to do for you to live healthy. Yes, healthy living. Tumeletana the one and only Sylvia Wanja. And you're back after that very short break so that we can now wind up and get to answer some of the questions ambazo mko nazo on matters TB. Yes, tuberculosis. And by the way, yesterday as we were talking about TB, kuna mtu aliniuliza initaje na Kiswahili, it was a challenge. So I got to know. Yes, inaitwa kifua kikuu. Ama namna gani?
Ugonjwa wa kifua kikuu.
Ugonjwa wa kifua kikuu. Yes. So that's the Kiswahili name. Yeah, tuberculosis, ugonjwa wa kifua kikuu. Yep. Anasema good morning to you too. Anasema I have been diagnosed by tuberculosis 1 month ago. I've been on medication, but no improvement. What do I do?
Please go and discuss it to the healthcare worker, the healthcare provider, so that we may do additional tests and additional examination, and then I will be able to be guided and helped.
Yeah.
Yes.
Yeah, because 1 month is a long time with TB.
Yes.
Yeah, you need to go get checked. Tukona Lynn from Nairobi anasema good morning Rachel and Daktari. Anasema what is the cause of accumulation of fluid in the lungs, especially as a young adult? Sema being drained na haishi. Lynn from Nairobi. Sema kona some fluid in the lungs inakuwa drained na haishi, and she's a young adult. What would be the issue?
Yeah, that is true. That is an infection that happens, or a condition, I would say. We call it a pleural effusion. So it has many causes. TB is just one of the other many causes.
Yeah.
So it needs to be investigated. The fluid will be taken, of course, and I know they're doing that with the doctor or the healthcare provider. It will be taken to the laboratory and be investigated, and from that it will be guided. We achieve the cause of that pleural effusion.
Yeah.
So we have many causes of pleural effusion.
Oh wow.
Yes.
Okay. Now, yes, we have other questions. We'll be getting some time to go through them.
Sure.
But for now, we've been talking about TB. Umetuambia how TB is transmitted, what you should do to make sure that we do not get the TB, and we've talked kwa mapana na marifu about TB. So what would be your parting shot on the same?
My parting shot is that TB is curable.
Yeah.
That is very important to do and to know.
Yeah.
And to know that what we need to do is to make use of the health facilities that we have. Whether you feel it's TB or you're not sure, please let's make use of our health facilities, because I know we have so many health facilities ranging from dispensary to those high-level facilities. The healthcare workers, all of them were there. They are able to diagnose TB, like right from our history and the investigations. We have very good networks of networking our samples to the testing facilities. It is free, absolutely free to diagnose TB. That is the laboratory test, apart from the X-rays and other imaging modalities. So it's good to be checked. That's what I would say, and to emphasize that early diagnosis is very important. Adherence to treatment is very key.
Kwanza unatakana waambie sana.
Yes.
Wamalize dose na wafuate vizuri.
Na hiyo tunapona kabisa. It's curable. We achieve the best outcome, which is cure, when we adhere to the treatment. And then social support. Please, community, social support is very important to people with TB. Yes.
Okay. Now, for people who would want to maybe reach you on the same to ask questions, ama wako na mtu mwenye labda anashuku wako na TB and they would want to come get checked. Do you have mahali wanaweza kupata, or maybe contacts that you'd share for the same?
I work for the county government of Nakuru, Department of Health Services. And as I said, personally, I do coordinate the TB activities in the Nakuru West Subcounty. In each and every subcounty, we have a TB coordinator. We have facilities where we support, and we have healthcare workers there. Please don't look for a particular person to help you out. go to our facilities. Yes, but I am with the Department of Health Services.
Okay.
Yes.
Okay. So wakuje watasaidika.
Kabisa.
Yes.
With a lot of confidence that utasaidika to our facilities.
All right.
Yes.
Perfecto. Thank you so much for coming. Thank you so much for being with us today.
Thank you.
We've learned a lot.
Asante sana.
And I know for the question and answer, for the time that we've not been able, the questions that we've not been able to answer, we are praying and hoping that we will have another chance for Q&A for TB specifically, so that anyone who would be having any questions about TB, they'll be in, or they'll be able to get answered. But I love that you've said, wakikuja pale hospitalini,
yes,
they'll get help.
They will get help.
Yes. And just to emphasize, if you're feeling kama hauko sawa, please make sure that you go to hospital early enough. Ukienda mapema, then it means that itakuwa detected mapema, and it will be very possible for you to get treatment early enough. Na wale watu wenzetu wenye tunapewangwa dawa alafu atumalizi tukifili kama tuko sawa, and the symptoms zimeenda chini, we are like, we are good to go, let's continue with the work. Make sure umalize. Make sure umalize dawa. Remember, there's the variant of TB ambayo inaitwa the drug resistant.
Yeah, the drug-resistant TB.
Drug-resistant TB.
Yes.
Na hiyo inakuja when you do not finish your dose well, or you don't follow up with your dose vizuri.
Yeah, that is one of the factors that can contribute to that. And yet, you know, when you have that drug-resistant TB, if you transmit it to the next person, they will get the same type of TB, which is not a very good thing to the community.
All right.
So if you get TB, the strain that I have for TB, if it's the drug-sensitive TB, that is what I'll transmit to you.
Okay.
If I have the drug-resistant TB, be sure that is what you transmit to your contact, which is not a very good thing to do. It's quite expensive to treat. It may end up leaving a lot of complications to you, and it has a lot of medication, which are capable of causing more side effects. So no one would want to go there. But if it happens and you get that one, we will walk the journey with you. We have treatment for that. Yes. It's curable as well. So yes, it is curable.
Okay. Asante sana. Thank you so much for coming. We'll plan for another session for Q&A. And now I see we have Pastor Mwende from Makendo. I see you are asking about cancer. Yes. So next week we'll be talking about cancer. So today we are talking about TB, and of course what you're supposed to do kama uko na TB ama una feel ni kama you have symptoms za TB, what are the steps that you are supposed to take. So that is what we've been talking about. But next week, God willing, we'll be talking about cancer. So any questions that you have, please zilete, and then we'll be able to answer. But Pastor Mwende from Makindu will get someone who will be able to help you. Do not worry. Sawa sawa. Once again, thank you so much for coming. Thank you so much for tuning in. Now we'll be taking a very short break where we get some music, but also that means that tutakuwa sasa tumetoka upande wa Facebook, tutakuwa tumetoka upande wa YouTube as well. So right now tutakuwa tunapata health tips. Na leo ndani ya health tips tunaongelea there is ukwaju. Yes, ni ukwaju. So we'll be talking about that, and I know that it's going to be really helpful for all of us. All right? So tutakuwa tunapata health tips, and then after that we'll be going for a very short break to pata some 2-3 music, and then we'll be coming right back to look at the pointers. Yes, leo kwa discussion yetu, what is our takeaway? What is our take home? So hata wewe tukipata hiyo break kidogo, it is your time to just think and remember. Alafu pia unaweza tuambia through our numbers 0721 105 of course on 23814, our SMS code, on Facebook, on YouTube, and of course on my Facebook page as well at Rachel Kahugu, using the hashtag Kahugu and hashtag Afya Clinic. Tell us, what do you remember, or what is your take home from today's discussion? We've had Diana Mutemi, and she is the Tuberculosis and Leprosy Coordinator in Nakuru West Subcounty. Once again, asante.
Asante sana.
Yes. So we'll be getting the health tip. I'll have to talk security.
Leo tutakuwa tukiangazia umuhimu wa juice ya ukwaju. Tunda la ukwaju ni tunda lenye faida nyingi sana kwa afya ya mwanadamu. Tunda hili huweza kutumika kutengeneza juice ambayo matumizi yake yana faida kubwa sana katika afya ya mwili wa mwanadamu. Faida ya juice ya ukwaju ni kama zifuatavyo. Ni chanzo kizuri cha viuasumu mwilini, yani antioxidants, ambavyo huzuia saratani. Pili, ni chanzo cha vitamin B na C, vile carotenes. 3, hushusha joto la mwili na kuondosha homa, hasa homa ya malaria na homa ya matumbo. 4, hulinda mwili dhidi ya mafua na kero za mafua kooni. 5, husaidia myeyusho na mmeng'enyo wa chakula na kuondosha kuvimbiwa. 6, husaidia kutibu matatizo ya nyongo, yani bile disorders. 7, husaidia kurahisisha choo. It acts as a laxative. 8, husaidia kupunguza wingi wa lihemu, yani cholesterol, na hivyo kuimarisha afya ya moyo. 9, husaidia ngozi kuwa nyororo, vile husaidia ngozi inayopona baada ya kuungua au yenye vidonda. 10, husaidia kuua minyoo tumboni, sana sana kwa watoto wachanga. Unatakiwa ujaribu kuweka ukwaju karibu katika kila mlo wako kwa kila siku, kwa sababu ukwaju una faida nyingi kiafya ambazo hakika zitakufanya uwe na afya njema na kuimarisha afya yako kiujumla. Ni hayo tu kwa sasa, tupatane Jumatano ijayo. Jina langu ni Perpetual Nyambura.
Yup, and we are here for the tips because you've said it's very important for all of us to know. Leo tumelan nini, yeah? And of course, you still have some time. You can always tell us what is your take home from today's discussion. So here it is, some of the things that you've learned. So, number 1, it is that tuberculosis, or rather TB, ama kifua kikuu. Yes, I have learned here Kiswahili and I've forgotten mwenye alikuwa ameniuliza, but I'll check. So, kifua kikuu, it is a bacterial infection, it's airborne, and it can affect all parts of the body except the nails, makucha, the hair and the teeth. Yes, kwa hivyo unaweza sikia kuna mtu ako na TB ya skin, TB ya mgongo, TB ya bones, ya anywhere, yeah, hata tummy. Yep. So it is very important for all of us to make sure that unajilinda, unajitunza vizuri, and we'll be looking at what to do so that you cannot get the TB. So that is it. Number 2, symptoms of TB in adults sana sana ni sweating, fever and persistent cough. So kama uko na any of these, make sure you go get checked. Especially hapa kwa sweating, doc alisema that you realize you're sleeping, alafu by the time unaamka umesweat sana until your sheets are very cold, are wet rather, make sure that you go get checked. It is not normal. Sawa, so go get checked. And then in children, it's usually chest infections where you realize your kid ana cough ama kona different issues kwa chest. So the other one is delayed milestones. Yes, delayed milestones. So you need to check. Mtoto wako unamjua venye wana grow. Kama kuna some delayed milestones, you need to take her or him to hospital so that he can get checked for the same. And then late diagnosis can cause permanent damage to the airways. Kwa hivyo, make sure you go get checked mapema. Ukikaa sana, you might just be damaging your airwaves. The other one is your airways. Yes. The other one is to avoid the spread of TB, maintain good hygiene. Yes, ukwe msafi. Proper coughing etiquette. Don't just cough like this. Tuliambiwa the best way ya kucough ni or you can use your handkerchief, or you can use a serviette. Just make sure that you're coughing properly. Okay, and then proper ventilation. That's also very, very important. And our last tip for today, or take home, is that to make a fully recovery, ensure proper adherence of medication. Hii ni wale watu ambao hawamalizangi dose. You must make sure that unamaliza dozi yako vizuri and you follow your medication proper. So that is it. Today we've been looking at TB, and I know that we all know what we are supposed to do. Okay, now we'll be getting did you know, and now this one is usually very, very interesting. Sasa ndani ya did you know today, we are looking at, do you have it on the screen? Okay, so the did you know today is that, did you know that your taste buds have a lifespan of about 10 to 14 days? Ay mato. Okay, so did you know that your taste buds have a lifespan of about 10 to 14 days? So the mind behind this, anaitwa Martin. So taste buds zako ziko na lifespan ya 10 to 14 days, and then after that they expire, Mato, and then they come back. Okay. Yes, so after 10 to 14 days ni kama zinakuwa rebirthed. Yes, so go check. Go check. So that's a really good did you know. That's something that you can think about, you can go check, and yeah, it's good to discover that your taste buds only live for 10 to 14 days, alafu zina shoo, and then others, they come back. Okay, that's very interesting. So that is it on the did you know today, and then now we can look at the actionable tip. So today, I remember last week, and if you remember as well, last week tulikuwa tumeagree tukunywe maji 8 glasses per day, kila mtu. And then mtaniambia how it goes. And yesterday I had 2 people wananiambia drinking water is not a joke. Mtu nakunywa glass 2 alafu jioni ndoko like, oh my god, I was supposed to take 8 glasses, but I've only taken 2 glasses. So this week we'll continue taking water. Make sure that you do take 8 glasses of water per day. And then by the end of this week, pia tutakuwa tunakuja kuambiana easy 8 glasses of water. Unaona kama ina change anything? Does it change anything in your health? Unafeel kama kuna any change? So we'll be talking about that, especially digestion. Najua inasaidianga sana digestion, but also today we'll be talking about TB. So this week, of course, mnajua wiki yetu kwa Afya Clinic inaanzanga Wednesday to Wednesday. So next Wednesday we'll be looking at, have you been able to follow everything yenye tumeambiwa hapa, especially the coughing parts, that maintain hygiene, but also when coughing, don't just cough vile unataka. Make sure that una cough na either hapa, yes, the inner sides of you, munaelewa ni hapa, yes, very important. So either cough na hapa, or use your handkerchief, or use a serviette or a tissue, alafu natupa. Also make sure that you clean your hands. Ukiwa mahali after, either before eating, don't touch your face, the hygiene parts. Okay, so that is what we are looking at this week. Wiki yetu ya Afya Clinic ni Wednesday to Wednesday, so Wednesday we'll be coming to look at it. For now, let's get the today's inspiration. And of course, unajua ndani ya today's inspiration, you get inspired, because lazima tuanze siku yetu tukiwa very much inspired. So on this beautiful Wednesday, on the today's inspiration, kama vile ambavyo unaona kwenye runinga yako, is that when you are enthusiastic, that's it. Yes, today's inspiration, as you can see, inasema when you are enthusiastic about what to do, you feel this positive energy. It's very simple. Yeah, that you have to be very enthusiastic about what you do, and then you will feel that positive energy, and everything you do will be very simple and due to be extremely perfecto. Sawa sawa? So that is it on our today's inspiration. Today, of course, ni Blessed Wednesday ndani ya today's inspiration. Thank you so much for tuning in. We've had an amazing time. Asante sana. God bless you. We've had an amazing time. I know that you have learned. Now I'm looking forward to seeing you next week ndani ya Afya Clinic. And then we'll be able to discuss. Have you been able to check on your healthy living? Yes, make sure that unaosha mikono zako vizuri. Make sure that you do not touch your face sana sana. Make sure that you drink 8 glasses of water each and every day. So we'll be talking about that on Wednesday. Most probably on Wednesday we'll be talking about cancer. Nimeona pastor amekuwa akiuliza about cancer. Kuna mtu ambaye amekuwa na issues za cancer sana sana. So next week, do not worry. Follow our Facebook page, follow our YouTube page, follow me on Facebook as well on Kahugu, and you'll be able to see what next week we'll be talking about. Others, thank you so much for tuning in. God bless you. God be with you. Enjoy the rest of your viewing. My name is Kahugu.